Hello, my name is Fatima Saad, and I serve as a community outreach coordinator with the CASSIST Free Family Health Clinic. Through the Partnering for Vaccine Equity program, we've been able to work with the community to educate and dispel myths about both the COVID-19 and flu vaccines. Let's stay connected following this presentation. I encourage you to follow us on our Instagram account and reach out to us via email with any questions you may have. A little bit of an overview on this presentation. I'll be talking about some background regarding CASSIST, a description of our current community outreach-based program, some outcome, including some data on our vaccination rates, and we'll wrap up with our plan for next steps and our conclusion. So for some background information, CASSIST is a free family health clinic that was established back in 2016, and its focus is to bridge gaps that impact the delivery of necessary and preventative medical care to underserved and uninsured communities. Last year in 2021, CASSIST received funding from the Center for Disease Control and Prevention, Health Resources and Services Administration, and the National Association of Free and Charitable Clinics. This was to educate the community about COVID-19, combat vaccine hesitancy, and administer COVID-19 and flu vaccinations through our mobile clinics. To provide some information on what the name CASSIST stands for, it is about community, advocacy, support, sustainability, inspiring others, serve, and teach. And our clinic philosophy is, our goal is not to see how many patients can be served, but how much service can be provided to each patient. For our project overview, our vaccination clinics are fully staffed with healthcare professionals as well as cross-trained outreach workers. This includes vaccinators, registrators, and teams for setup and cleanup. This allows for efficiency so we can focus on providing the best possible service to our patients. Our team is responsible for remaining up to date with the most current CDC guidelines, and we coordinate training sessions with educational discussions so we can best prepare ourselves. In addition to being prepared with the intellectual tools to serve our community, our team is equipped with the physical tools necessary, such as laptops, iPads, and mobile hotspots. It's not enough to just verbalize our educational tips to our patients, so we create tangible, up-to-date educational materials in multiple languages, and this can be taken home with our patients. We focus on providing continuity of care and send follow-up reminders for our patients' second shots, boosters, as well as provide clinic contact information for future references. Since June of 2021, we've administered close to 1,900 vaccinations. This includes about 1,700 COVID vaccines and over 200 flu vaccines. There have been over 400 dose 1 shots administered, 300 dose 2 shots, and 945 booster shots. With our COVID vaccines that have been administered, about 70% of them have been administered to adults age 18 and older, and approximately 31% have been administered to children between the ages of 5 to 17 years old. Through our events at a variety of different locations, we've experienced a mix of challenges and successes. Our challenges include preventing breakthrough infections from discouraging vaccinations, information and fighting misinformation likely across social media. And over the last couple of weeks, we've been coming across community beliefs that the pandemic is over. With these challenges, we focus on centralizing our efforts and amplifying our educational outreach and providing facts and opportunities to discuss and ask questions. With regards to our successes, we've formed newly formed partnerships with the Michigan Department of Health and Human Services, various soup kitchens, school districts across Metro Detroit, and more. In terms of our next steps, we'll continue to utilize our social media, expand our outreach efforts, create educational material, and reflect and re-strategize so we can effectively and efficiently serve our community. We'll continue to ask ourselves, what can we change with what we are doing to best increase our impact? Since the implementation of our project, we've been able to connect with individuals from all different backgrounds. We've continued to plan our events over the next couple of months. The only way we'll be successful in fighting this pandemic is if we work together to educate, empower, and impact our communities. Here are some pictures from our events and various social media efforts. That's the end of my presentation, and thank you for your time.